Theodora Scarato is Executive Director of Environmental Health Trust, where she is a lead policy researcher and maintains their EMF policy database. She testifies and has published on EMF-related public policies. She also has a master's in social work.
I'm going to talk today about international governments, regulations, and rules related to cell phones, wireless, and 5G. This is a brief review of international policy. There are over 20 governments and countries which recommend without reservation that people should reduce cell phone radiation to the brain, and especially for children. So I have here the United Kingdom, Russia, Switzerland, Finland, and several other countries. However, they don't all have the same recommendations. Each country has a different set of laws, policies, and some of them only have information on the health ministry site. So for example, the United Kingdom has a little-known web page which says, uncertainties in the science suggest some additional level of precaution is warranted, and they recommend that children should be discouraged from excessive use of mobile phones. While France and Cyprus have large-scale campaigns that recommend children should reduce exposure to their brain with how to reduce exposure to wireless by using wired connections and a whole manner of recommendations. However, in the United States, the US CDC says, if you are worried about cell phone use, follow these tips below, and they have 2 tips. And the US Food and Drug Administration recently updated their web pages downplaying the health risks of cell phones and wireless and radio frequency, rejecting US government research on the issue of radio frequency. And they state, with colorful pictures of people holding cell phones to their head, current scientific evidence does not show a danger to any users of cell phones from radio frequency energy, including children and teenagers. However, in France, for many years, there have been recommendations to reduce exposure with public campaigns, such as this from Lyon, France. This is a 2008 cell phone radiation campaign. The translation of the posters is a mobile phone before you're 12, no way. Let's keep them healthy and away from mobile phones. And they have quite extensive regulations over the years, a law passed in 2010 as well as in 2015 with regulations on cell phone radiation, including labeling of cell phone radiation when you purchase the phone, measuring cell phone radiation levels, restricting Wi-Fi in school, and most recently, the labeling informs users to keep the equipment away from the belly of pregnant women, keep the equipment away from the lower abdomen of adolescents, and several other actions, actually all of which is on our website at ehtrust.org. The paper, Building Science and Radio Frequency Radiation, which I was co-author to with several experts, reviews the adverse effects of radio frequency at levels below regulatory limits and makes recommendations to the building industry on how to reduce wireless in buildings with the use of wired rather than wireless telecommunications connections, as well as for HVAC systems, security, and telephones. And it is a very useful tool and paper that pulls together a lot of information, as well as policies on reducing exposure to cell phone radiation. In that paper, we have a graph on several of the countries which have allowable levels for cell phone radiation far more stringent than the United States, such as Russia, Israel, China, Turkey, Bulgaria. Also, and not included on this graph, are India, Switzerland, Italy, and several other countries. Now, industry white papers are stating that in order to deploy 5G and actually 4G fully, that they need to loosen these more stringent allowable thresholds of radio frequency. And they have been funding large-scale public relations efforts to get several countries to change their limits to accommodate 5G. They've been successful in Lithuania and Poland, but not in Switzerland, where the parliament recently decided they would not change their limits to accommodate 5G, despite heavy funding by industry. Several countries have schools and homes designated as sensitive areas with extra protections. Chile and Greece don't allow cell towers on school grounds. The Los Angeles School District has a threshold of 10,000 times less than FCC limits, although there are several issues related to measurements and others that makes it still non-protective. Several countries like Switzerland and Belgium have a different threshold for schools and homes. We also have on our website international policy moving forward to halt or restrict 5G and the small cell rollout. So in addition to actions in the United States, with which CC covered already, there are over 600 governments in Italy, in the United Kingdom and Ireland, and in Greece, local actions, as well as several other countries where the mayors and the elected officials are issuing resolutions to halt 5G until safety is demonstrated in research. And there are safety reviews going on in various governments, some hijacked by industry-tied experts, but nonetheless, in Netherlands, their latest health report actually recommends against using the 26 gigahertz frequency band because of the lack of data on safety. In France, the federal health agency ANSES is researching 5G, issuing reports on the health and safety issues related to 5G. And there are several other countries amidst consultations right now, including Bermuda and Slovenia and Nigeria. Here is an example, and there's news all the time coming out of Italy. This is a mayor, the news story on him ordering the suspension of 5G until there is safety. We also have on our website as a resource lists of the medical organizations who are issuing resolutions and putting forward their statements related to 5G, such as the 5G appeal, which you're aware of with over 400 scientists, the Cyprus Medical Association, and there are many, many more than I have on the slide. The Belgium electrosmog appeal as well. There was just an appeal out of the UK. Several countries have stricter limits on magnetic field electromagnetic radiation near homes. And in the United States, there was a defunding of the Environmental Protection Agency. But in California, because of the EMF project and research going on there, there is educational code actually with setbacks from high voltage transmission lines and the building of new schools in order to minimize the exposure to magnetic fields. And several countries like Italy, Israel, Denmark, Poland, France, Netherlands, Slovenia, Finland, and Croatia, and others have restrictions on new builds stating that the limit cannot be over 3 or 4 milligauss because that is the level associated with childhood leukemia in several studies. So just to give a short overview of the history of regulations and rules related to radio frequency, radiation, wireless in the United States. Electromagnetic fields and health, the issue was robustly funded after the Cold War. However, starting in the 80s, there was a defunding of the Environmental Protection Agency. There was an interagency group of several agencies, military as well, working on the issue of health effects. Just as the EPA was going to develop safety standards and was tasked to do so, they were fully defunded in 1995. And in 1996, the Telecom Act was passed, and the FCC adopted radio frequency radiation limits largely from industry-tied groups based on the outdated and proven wrong assumption that heating is the only harm. There have been no limits for magnetic fields adopted by the United States. In 2012, the Government Accountability Office issued a report that the FCC standards may not reflect current science and should be reassessed. That was followed by the FCC opening up a notice of inquiry, meaning they opened a record where scientists, physicians, and members of the public submitted thousands of pages of documentation that FCC limits were not protective. And of course, industry put in documentation that the limits were fine, and in fact, they could be loosened further. However, in 2019, the FCC terminated their notice of inquiry and kept their radio frequency radiation limits unchanged, saying there was no reason to change them. So in 2020, Environmental Health Trust and Children's Health Defense and several other petitioners filed a legal appeal challenging the FCC's refusal to update these limits. So what is our legal appeal about? We are contending that the FCC ignored substantial record evidence when they made their decision to maintain the radio frequency radiation limits from 1996, and that they violated the Administrative Procedure Act because its order is arbitrary and capricious and not evidence-based, and that they violated the National Environmental Policy Act because the FCC did not take a hard look at the environmental impacts, including human health effects, on its decision, violated the 1996 Telecommunications Act because the FCC failed to consider the impact of its decision on public health and safety, and because FCC regulations are preempting the ADA and FHA accommodation obligations for those who are afflicted with radiation sickness. And this has been supported by 4 amicus briefs, each of which is so important to read. I recommend going to our website and downloading them. The Building Biology Institute's amicus brief detailed examples of people who have been harmed by radio frequency and electromagnetic radiation. The Natural Resources Defense Council talked about the history of the electromagnetic field regulations in the United States and how the National Environmental Policy Act should be triggered. The amicus of Dan and Catherine Kleiber talked about how their family was injured by electromagnetic fields and how accommodations have been repeatedly denied by authorities who are citing FCC limits as the reason that they didn't have to accommodate the members of their family. And the amicus of attorney Joe Sandry includes a declaration of Dr. Linda Birnbaum, who's the former director of the National Institute of Environmental Health Sciences. And she talks about the unfounded criticisms related to the National Toxicology Program. And one of her statements, which I'll quote, is overall the NTP findings, that's the National Toxicology Program study on cell phone radiation, demonstrate the potential for radiofrequency radiation to cause cancer in humans. In the meanwhile, Belgium has banned the sale of mobile phones designed for children several years ago, and France and French Polynesia have done the same. There's also a ban on advertising cell phones to young children. This is a picture from St. Augustine School in Italy, where the Wi-Fi router is being ceremoniously removed from the school. And there are several private schools who are removing wireless networks, as well as government regulations in Cyprus, which has a directive to replace Wi-Fi with wired networks in their elementary schools. France, Israel, and French Polynesia also limit Wi-Fi in schools as well. All of this is on our website. This is a full back of the bus ad out of Cyprus, where they have a large-scale public education campaign. And the translation is to the side there: don't irradiate me, learn how to protect me. And they have flyers and PSAs. They have videos for pregnant women, for parents, and for teenagers on how to reduce exposure. The Archbishop Macarius Hospital in Cyprus has replaced the Wi-Fi with Ethernet in the pediatric care intensive units and the neonatal units. And parents are educated to keep the phones away from their children and out of the pediatric unit when they are visiting their babies. In addition, this is images from a poster on the wall and a screen save from one of their flyers where they educate parents on using wired connections, how to turn the device onto airplane mode, keeping the Wi-Fi off, and other ways to reduce exposure. And this is one of the many graphics we have. I hope you will make use of our resources. You can download posters and flyers. This is showing examples of a lot of these policies around the world that I've just talked about with a map. We have a lot of resources online at Environmental Health Trust educating on what these international policies are that are far more protective than the United States. Peterborough, Ontario, Canada actually has an electromagnetic hypersensitivity tip sheet where they inform people who are having meetings how to accommodate people in relationship to electromagnetic fields. So, for example, notifying all the meeting attendees to set their mobile phones to airplane mode at the start of the meeting, disabling the Wi-Fi in the room, turning off the fluorescent lighting, consider booking meeting rooms when it's daytime so that you don't have to turn on the fluorescent lights if that's the only option. And you can use this as a resource in your community as well, because this has been done before. And we need to take all of the work of people from around the world and help uplift our communities so that we can get to work with changes that protect people in the United States and worldwide. There's also on our website and other websites lists of accommodations and litigations where there are people who have not been accommodated and had to go to take legal action. So in Spain, there have been multiple court judgments, and we have links to these examples on our page on electrical sensitivity on ehtrust.org. Teacher unions, such as the BC Teachers Federation resolution, supports members with electrical sensitivity. There have been cases like in Australia where a worker was paid their salary after being injured by electromagnetic fields. Teachers, such as an LA school district teacher, accommodated to a Wi-Fi free classroom. Unfortunately, there are several teachers in California with legal action now where they have not been accommodated. But it has been done. I know in my state of Maryland, I know social workers who've been accommodated in their workplace as well. A lot happening in France. And there was recently a ruling related to smart meters where 13 of the 200 plaintiffs were able to get protections related to the wireless meter. Just a ruling in Pennsylvania where they ruled that the state cannot force people to accept smart meters. Several cases in Italy where wireless phones were deemed to have caused tumors. And in fact, the judge also ruled that industry-tied science could not be used in the courtroom. And there is ongoing litigation in the United States with people who have cell phone radiation-associated brain tumors, and that's been winding through the courts for years now. In French Polynesia, I wanted to share with you this 30-second video that was developed by the government. They have videos and brochures like Cyprus and France do as well. They recommend against children under 14 using cell phones. They explain that baby monitors emit wireless radiation. They explain how to reduce magnetic field radiation. And of course, they have laws like France as well, prohibiting advertising that promotes the sale or use of a cell phone to children under 14 years old. So let me share with you this PSA they have.
Les appareils que nous utilisons dans la vie quotidienne. Pour s'en protéger efficacement et bien utiliser son mobile à la maison comme au travail, adoptons les bonnes pratiques. Retrouvez toutes les informations sur dgun.pf.
And I hope you can see the translation that's right under there. You also can go to our website at ehtrust.org or to our YouTube channel where we have a list of videos from countries which we've translated as well. We also have flyers what parents need to know about safe technology, flyers on 5G, how to wire up your computer, and all kinds of resources which you can use to educate your community, your patients and clients about this issue. So thank you very much. We've covered international policy from cell phones to wireless to 5G. Please go to our website at ehtrust.org, sign up for our newsletter, and contact me with any questions. Thank you.